She's brilliant, and I'm sure you're going to have a great time. So here she is, Dr. Coles.
All right, welcome everybody, and thank you to the Prince of Peace Church for allowing us to use this space. I'm glad you guys made it on a Friday night. It means a lot to us. We're going to talk for probably about an hour, maybe a little longer. We'll have plenty of time for questions at the end. So if you do have questions, maybe just keep track of them, and then we'll get to it at the end, and I'll open the floor for any questions. If there's anyone who doesn't know us or haven't been patients of us, we are both naturopathic physicians and licensed acupuncturists, and our clinic is right upstairs, so we hope you'll pop in and see us. All right. We're going to start by talking about oxygen. Ozone therapy is a form of oxygen therapy, and oxygen therapy can take you from fatigued to fantastic. And the reason is that oxygen provides you the energy to do all the things you want to do, right? Oxygen is equivalent to life for all of us as human beings. Without oxygen, we are not a living creature, right? And one of the things that we can utilize is we can utilize oxygen medically in a very specific way using ozone, and really it can take you like that to feeling like that. So stay tuned, it's quite exciting. I'm going to start by introducing a concept called the vis medicatrix naturae. Anybody ever heard of this? Okay. Anybody know Latin? All right, the vis medicatrix naturae is one of the very first principles of naturopathic medicine, and it translates to the healing power of nature. So as naturopathic physicians, we really embrace the concept that nature can provide so many different avenues and aspects of healing in many different ways. So this concept really ties in nicely with what we're going to be talking about, because ozone, who's heard of ozone? Just heard of it. Yeah, right, we've all heard of it because ozone is a naturally occurring element. And oxygen, as we know, is a naturally occurring element, and these things found in nature have this really remarkable capacity to heal in so many different ways. All right, so just to chat a little bit more about the principles of natural medicine and naturopathic medicine. You see the first one is working with the healing power of nature. Discuss that a little bit. The other things that we do with almost all of our patients with any condition that's going on is we want to identify and treat the root cause. We want to do no harm, so we want to pick therapies that are the least invasive and the least toxic as often as we can. We want to treat the whole person. If you come in with some back pain, we want to help your back pain, but we also want to understand that you're not just a back hanging around, walking around. You're an entire body, you're an entire system. So we want to look at the entire person, the whole organism, because everything's connected. Come on in, come on in. Find a good seat. All right. We also have a word that we use called docere. It's another Latin word, and that translates to doctor as teacher. And that's why we're here tonight, is because both Dr. Steelsmith and I are very passionate about sharing our knowledge and educating all of our patients so that if you become educated, you can then educate other people in your life, and you can understand the choices that you make and how you can actually keep yourself well. We don't just want you seeing us for everything. You know, you can see us for everything you want, but what we want is you to learn how to be a good shepherd of your body and to take the best care you can. And then finally, prevention is the best cure. So if we can prevent a chronic disease from occurring down the road, that's obviously the ultimate goal. So these are the principles of naturopathic medicine, and we like to go over these at the beginning of our talk just so you understand that even though we will be discussing ozone and you might feel like, wow, ozone can fix everything, because it kind of can in some ways, but really it's actually about one tool in our toolbox for all the other things that we do to help you live as healthy as you can, be as vital as you can. Did you guys know that oxygen is the cellular foundation of health? Yeah, some nods here and there. Health, vitality, all depend on how efficiently your cells can process and utilize oxygen. That is what health is. At a cellular level, if your cells are using oxygen and they're using it efficiently, that will be the catalyst to health in every organ system we're thinking about. In your liver, in your heart, in your joint spaces, in your brain. If these cells are doing what they should do and they're utilizing oxygen appropriately, they will be vital, healthy cells. If we don't have oxygen in our cells, or we have situations that start to deplete oxygen in our cells, that's when disease starts to occur. That's when cellular degradation starts to occur. And then that's when we lead into the start of different disease processes. I'm going to get a little more in depth about exactly how oxygen creates our health a little bit later. So that oxygen utilization, being able to use that oxygen, is key. So this is really cool. The difference between being 20 versus being 50 or being 70 is your ability to utilize oxygen efficiently. That's aging right there. Your cells at 20, and the research shows this, your cells at 20 utilize oxygen very efficiently. When you get about age 38 is what the research shows us, but as you start to age, starting around age 38, the oxygen utilization in our cells starts to diminish. And as that progresses, as we're aging, then we find that we start to have the diseases that come with aging. What's really interesting, because you might be wondering, is that it's not necessarily how much oxygen you breathe or your fitness level that creates this issue with oxygen utilization. We're going to get into exactly what the process is in a little bit, but it's not that you just don't breathe as well as you get older. It's not that you have been breathing shallow your whole life because then all of a sudden you're all stressed out. It's not that. It's actually a cellular change of how the cells are able to take the oxygen in and use it, okay? It is about being able to deliver oxygen to the cells themselves, okay? So how do we get oxygen to our cells? You guys probably know, right? It's got this thing that pumps here, your heart, and it pumps your blood, and it pumps your blood everywhere, all over, right? That's what your heart is doing. And then you're breathing, and your lungs are filling up with air, and we're getting the oxygen there, and that's going to your heart, and then your heart is taking that oxygen-rich blood, and it's taking it through your arteries, all the way to your tiny capillary beds, and then the oxygen should be set free, right? And from that capillary bed, that's where our cells should be able to take the oxygen, take it in, and utilize it, okay? So the problem starts to occur with, first step, that delivery of the oxygen. How efficiently are we actually delivering the oxygen into the capillaries? And then how efficiently are we able to, as a cell, take in that oxygen and then use it? And that's where things start to have problems. So what are some signs of significantly decreased oxygen utilization? So we can have things like shortness of breath. We could have exercise intolerance, so difficulty exercising. We could have sensitivity to cold. We could have decreased body temperature, chronic diseases, weakness. Fatigue is a really big one. Just a general overall sense of an increase in fatigue. Generalized pain. All of these are signs of decreased oxygen utilization and decreased mitochondrial function. So then what are the things that impair this oxygen utilization. What are the things that cause this to happen? Aging, so just as we age, we get worse at using oxygen. Having a diet that is high in carbohydrates and sugar, okay? What's very interesting with this is that when we eat foods that molecularly break down into sugar, which carbohydrates break down into sugar, sugar breaks down into sugar, as this happens, our cells will take a pathway in their energy production that no longer produces oxygen, okay? So there's multiple ways inside our cell that we can create this thing called energy, which is ATP, is what we call it scientifically. When we eat carbohydrates and sugar, especially as we're aging, that energy breakdown starts to go in a more anaerobic, anybody know that word? Anaerobic means less oxygen. We go through an anaerobic pathway of producing energy instead of an aerobic process, which aerobic means oxygen. So the diet alone all of a sudden makes your cells not be able to utilize oxygen. Environmental toxins and stress. Of course, stress does everything bad to us, right? We know that. Environmental toxins, specifically mercury. So mercury as an environmental element is very damaging to the cells that make our energy, or the organs inside our cells that make our energy, called mitochondria. Who's heard of mitochondria? Okay, a good amount of people, that's great. So we're going to talk a little bit more about mitochondria in a minute, but mitochondria are these energy producing organelles inside our cells. And mercury will kill them. I know. Mercury, too much mercury and too much toxic mercury, if your body cannot detox it, will kill mitochondria. So that's a really key thing. One of the things that we do very often is test our patients for mercury toxicity, because it is actually such an important thing to look for. All right, what else impairs oxygen utilization? Genetics. Anybody know who we get our mitochondria from? What? Who? Tell me. Your mama. Mama brings us mitochondria. That's right. So all of your mitochondria all come directly from your mom. Dad doesn't give us any of those mitochondria, right? So we can actually trace genetically mitochondria through the mother very, very far back. That's actually how, interesting National Geographic article on how they found the first woman. Not the first man, they found the first woman, because we can trace it through mitochondria. So genetics, looking at mom's genetics specifically for things like mitochondrial health is a very important thing to do. All right, lack of specific nutrients needed to make energy. This is kind of broad, but there's some really key nutrients that are required to use this oxygen inside the mitochondria, and some of them are important hormones. Your thyroid. So your thyroid is an important organ in your neck. It makes thyroid hormone, and thyroid hormone is critical and key for appropriate oxygen utilization. Other things like cortisol and DHEA, which are some other important hormones, those are very significant as well. And then there's B vitamins. So B vitamins are a type of vitamin that are actually very important when it comes to oxygen utilization. Injury or trauma to tissues. So this comes into play when we think about a lack of oxygen in our joints or our muscles or our musculoskeletal system, because injury or trauma will create a situation of low oxygen in that area. So our sort of teacher in this ozone thing, Dr. Schallenberger, he really says that pain equates to no oxygen. That's his equation. If you have pain, then you have an area in your body that is lacking oxygen, okay? And that can happen because you've, you bumped your elbow too hard, you had a surgical scar, anything that's kind of blocking the tissue from acting as a normal cell would. Oh, here, we decrease in thyroid and adrenal hormones. I already mentioned that. That impairs oxygen utilization. So automatically, if I have a patient who's been diagnosed with hypothyroid, which is a state where your thyroid is underfunctioning, already I know that they probably have an impaired oxygen utilization system. Chronic stress, there it is again. Chronic stress is just one of those things that we all really need to work on. And here I am preaching to the choir, and all of us we really need to deal with our stress. So, let's figure out a way to do that. This is a cool slide because this lists some of the major diseases or disorders that we found that enhancing oxygen utilization will be helpful for. So I'm going to go down the list here, and then I might circle back to a few things. Pain, anywhere in the body. So that means your knee pain, that means your elbow pain, that means your sinus pain, that means your, ankle pain, you name it, you have pain, oxygen utilization would be helpful. Autoimmune diseases, this is a really big category. An autoimmune disease runs the gamut of things like ulcerative colitis, rheumatoid arthritis, psoriasis, any of those autoimmune diseases, lupus, Hashimoto's thyroid, these type of autoimmune diseases can be helped with oxygen utilization. At the seminar we were just at was kind of interesting because it was a mix of naturopathic physicians, conventional medical doctors, osteopathic doctors, and there was what we like to call this rogue rheumatologist. So rheumatologists are the doctors who deal with autoimmune disorders, and we called her rogue because she was like totally not doing what most rheumatologists do. She's like, I'm not giving steroids, I'm giving ozone, and she was all about using ozone in her patients to help them be better and all kinds of amazing stuff. And really some cool stuff you can do with turning around autoimmune disease, maybe helping your patients get off medication if they're on severe medication. So very exciting. Run-of-the-mill fatigue. Oxygen can help, right? Who would have thought? Who feels better when you take deep breaths? Yeah, most of us. So if you get oxygen delivered in a very special way right to your cells at an amount higher than you're used to, you can bet you're going to feel pretty good. Cancer. This is a really big category as well. There is so much research being done right now in cancer and what's called hypoxia, or a hypoxic state. Hypoxia is the cellular situation that occurs when you reduce oxygen or get rid of oxygen. And what cancer cells do is they create a hypoxic environment around them. What this does is it allows them to improve their own survival, it allows them to be resistant to drugs, and it allows them to metastasize or spread and grow. Just by walling themselves off from oxygen in your body. There's an interesting study that just came out on triple-negative breast cancer, which, if you're familiar, triple-negative breast cancer is one of the more aggressive and more difficult to treat types of breast cancer. And what they were looking at is exactly this hypoxia-inducible factor, meaning what are the things that can stop these cancer cells from turning hypoxic? And utilizing oxygen therapy specifically can help with that. So there's a lot of research going on with cancer and being able to switch things around so that we may be able to have the chemo work better, right? Because the chemotherapy that people are taking, people get resistant to it, or maybe it stops working, and then that's a bad situation for people with advanced cancer. Things like ozone therapy can allow patients to be able to continue therapy. All right, so let's move on. Chronic viral infections and Lyme disease. So infections, many types of infections, are very well treated with oxygen therapy. Reason being is that ozone in particular, which we're going to get into in a minute, has a anti-infectious ability. It will kill viruses, bacteria. It's actually used in wastewater treatment plants to clean the water, and it's been shown to kill off really bad microbes, like antibiotic resistant microbes in wastewater treatment facilities. So ozone has actually been used in that for quite a while. So that's very interesting. Chronic viral infections, things like herpes, right? You can, if you have a herpes outbreak, coming in and doing some oxygen therapy for 2 days in a row can kind of knock it out. So really cool stuff. Lyme disease is a very difficult disease to deal with. There are so many patients who are using ozone therapy across the United States that are seeing amazing benefits with that. Okay, aging. So obviously we've talked about this. Enhancing your oxygen utilization can help aging. So the idea is that we take those cells that are 50-year-old cells and we start introducing oxygen and we turn them back to an ability to utilize oxygen like you were in your 20s. So that's exactly what we want to do, and the research shows we kind of can do that. Pre and post surgery, this is a great way if you're undergoing a type of major surgery. This is a great way to kind of precondition your body so that with the stress of going through surgery, you are going to do better. You're going to heal better after. We all know that healing after major surgeries can sometimes really put people back. And if we can do anything to help with that healing after, this is an excellent way to do it. Diabetes and cardiovascular disease. So this is really very cool. I have a few studies on this. Let me just make sure I'm going to tell you this right. All right, so when it comes to diabetes, there's the study I want to tell you about. It was a study done in rats. And unfortunately, there were 60 rats that they turned diabetic. I know, poor rats. But they turned them diabetic, and then for 60 days, they injected ozone for these rats, and they found at the end that the group of rats that they did ozone on versus the group of rats that they did nothing on, the rats given ozone had total antioxidant status that was significantly higher than rats without it. Now, antioxidants, I know I'm throwing out a lot of terms. Antioxidants are really important molecules that our body makes, but we also can find them in sources like plants and food. But antioxidants will help keep your cells young. So the ozone significantly shot up their antioxidant status, and they showed minimal alterations in regards to degenerated axons, which is degenerated nerve cells. They also showed minimal alteration in vascular damage. So if you know anything about diabetes, some of the really significant side effects are going to be the side effects that happen in the arteries and veins, where things start to break down, and in the nervous system, where people begin to lose feeling, they start to get non-healing ulcers on their feet, all kinds of things that really start to kind of catapult the demise and the worsening in their system. So this ozone treatment prevented diabetic neuropathy and damage, which is very, very interesting. And we see the same in humans. Cardiovascular disease. So in 2016, there was a study done in humans. We had 60 patients who had had moderate to severe strokes or cerebral infarcts. They broke them up into two groups, and one group had what's called MAH, or IV ozone. We'll get into that in a little bit. But the MRI results showed improvement in brain function, clinical symptoms improved, and there were no adverse reactions for these individuals who were treated with ozone for only 10 days. 10 days of treatment. And they were significantly better off. And these are patients that were moderate to severe, so post-stroke there were patients who were unable to walk and patients who had difficulty swallowing and moving. And they found a significant change when adding just the ozone for the recovery in these patients. Exciting, right? You all excited? All right. Neurodegenerative diseases, these are things like Parkinson's, your dementias, those kind of things, very useful. Macular degeneration, anybody know what that is? That affects your eyes. Right now, there's really no great therapies for macular degeneration. We don't have a lot of great options except for oxygen utilization therapies like ozone. Depression would be very helpful for. Slow metabolism. That's kind of interesting. So we can use oxygen to help our slow metabolism. This has everything to do with those little organelles I was talking about, the mitochondria. And those mitochondria that make ATP are partly responsible for things in your metabolism. So if we can improve those mitochondria, improve your oxygen utilization, improve ATP energy, we can really help shift a metabolism that has been stagnant for a very long time. And I'm talking about metabolism where we have individuals who say they are exercising, they are eating, barely any calories, but they feel like just by breathing they're gaining weight. And these are people who have an altered metabolism. And that altered metabolism is actually a significant cellular process that's happening. And to reverse that, there's multiple things we can do, but this oxygen utilization is a really significant one. Fibromyalgia. Fibromyalgia is a generalized term for an all-body pain syndrome. This oxygen therapy can be so helpful for those patients. It can help their pain, and it can help their overall well-being and their fatigue and their general quality of life. And then arthritis. So as we kind of mentioned, for pain and joint pain and musculoskeletal pain, this is amazing. In our practice, we do deal with a lot of women's health issues. And what's very interesting is that this enhancing your oxygen utilization is also very specific to some women's health issues. So we have endometriosis, we have pelvic scarring, we have post-hysterectomy pain, pelvic pain, painful periods, heavy periods, something called interstitial cystitis. This is painful bladder syndrome, C-section scars, scarring from cyst ruptures in the ovaries, mastectomy and lumpectomy scars. So you can see there's a little, we have a few things here. It's mentioning scars. We're going to get in depth into scar therapy using this in a little bit. Pelvic inflammatory disease, cervical HPV infection. So very helpful, just like we talked about the other infections, very helpful for this viral infection as well. Here they are. These are your little mitochondria. Aren't they cute? All right, so on the right, we have our beautiful blue cell. To the left is the orange mitochondria. And you can see that the mitochondria have a few membranes. So that little squiggly thing in the inside is indicative of the inner mitochondrial membrane, and then we have an outer mitochondrial membrane. Now, I know you guys probably don't want to go back to biochem with me, even though that was one of my favorite subjects, so I'll keep it brief. 3 things that are really important happen in your mitochondria. We have something called a Krebs cycle. We have something called a methylation cycle, and that might be a familiar word for some of you. And we have something called the electron transport chain. Who knows what an electron is? A few of us, okay. I know, I'm taking you way back to like chemistry and all kinds of things. So electrons are very simple molecules, and the electron transport chain transports these little electrons so that you can make H2O, or water. Okay? Okay. Water, super important, right? We all want our cells to be hydrated. So that electron transport chain makes water. Virtually all chronic disease is caused by a defective mitochondrial function. The research is showing this. Right now, we are on the precipice of research exploding into mitochondria. And what we're finding is that improving your mitochondrial function can cure so many different diseases. That whole list I listed, all of those, because really what I'm talking about here when I'm talking about oxygen utilization, I'm talking about the mitochondria. I'm talking about what happens in here. So when I'm saying you breathe in, oxygen gets picked up, it goes to your heart pumps your blood, it goes to your capillaries drop that oxygen off, it goes to your cells. When it goes to your cells, it has to go and get into this mitochondria. And your mitochondria have to use that oxygen to do all those things, the methylation cycle, the Krebs cycle, the electron transport chain. Okay? Kind of make sense? A little bit? Okay, good. When we are in a state of hypoxia, which is a lack of oxygen, we're going to generate some toxins. And these are things that are called free radicals or oxidants. They deprive the cells and the mitochondria of the vital functions. Your cells will no longer repair appropriately. Your cell membrane won't polarize, so things have trouble getting in and out of your cell, like your nutrients. Your enzymes, which enzymes are the catalyst to every single reaction that happens in our cells, all of those things will stop functioning when you do not have enough oxygen. This includes the synthesis of your antioxidants. So our bodies are amazing. They make the things we need, like antioxidants, but they need everything happening appropriately in your mitochondria to make those antioxidants. So as the mitochondria are injured because they're not getting oxygen, that antioxidant function starts to drop. Ultimately, your mitochondria die. And your cell doesn't necessarily die, but when you look under a microscope at a cell of maybe a 20-year-old and a cell of a 50-year-old, who has more mitochondria? The little baby, right? The little 20-year-old, the babies, they have tons of mitochondria. We lose mitochondria as we age. They die because of all those things I talked about, stress and genetics and eating too many carbs and all those things. So what we're really talking about today is how do we get more mitochondria and how do we get more oxygen to help keep the mitochondria we have happy and healthy and functioning. All right? Okay. That's good. All right. I think that I have hopefully talked enough about oxygen so you understand the importance of oxygen itself. So now I'm going to delve into ozone and what ozone is and how it's related to oxygen. So oxygen is O2, ozone is O3. And again, we're getting a little chemistry lesson in here. 2 oxygen molecules together, that's the air we breathe. Ozone is 3 molecules. Get rid of that. There we go. Ozone is 3 molecules of oxygen attached together. We have ozone commonly in our atmosphere, and it's created as sunlight hits oxygen. So when the sun comes filtering through and we have all this oxygen in our atmosphere, that sunlight actually creates a chemical reaction and splits apart a few oxygen molecules. And then when they recombine, a small percentage of them recombine into ozone. Now, I think most of us have heard of the ozone layer, yes? Mm-hmm. Yeah. So the ozone layer is probably the thing that you recognize the most when I talk about ozone. And in fact, that ozone layer is in our atmosphere and it's been created via the sunlight, but it's also been created by lightning. Lightning is a great way to create more ozone. In fact, this is just an interesting factoid. There are these lightning fields down in Venezuela called the Catatumbo lightning fields. Anybody ever heard of these? A few of us. I didn't really know about these until I was learning about ozone, but this is a river that opens up into a lake, and it has the highest density of lightning strikes out of anywhere in the world. Like 50% of all the days in the year, like 180 days, you can have close to 300 lightning strikes per minute for 12 hours a day. Look it up, Google it. The pictures are amazing. Anyway, these lightning fields create 10% of all of our atmospheric ozone. I know, it's very cool. All right, so we're creating, atmosphere creates ozone. We have a little bit of it. The concept of the ozone layer depleting, that kind of thing, it's an interesting concept. It really actually has to do with a depletion in oxygen, not necessarily more ozone, because as you lose oxygen, you will deplete the ozone layer because you do not have enough oxygen around to create it. So it all goes back to oxygen. I'm going to talk really quick about a few other things when it comes to ozone. I talked about the wastewater treatment plant. So we're actually using ozone in a lot of ways right now outside of health. We're using it to disinfect. We're using it to actually keep our fruit on the shelf longer. So when you look up research on ozone, as I was doing early this morning, just to find interesting tidbits to share, I found a research article that was studying the effects of ozone on pitaya, a dragon fruit, right? And what we found is that when they treat pitaya fruit with ozone, it inhibits fruit decay after you've harvested it, and it reduces the decay rate, it induces enzyme activities of antioxidants, and it reduces levels of reactive oxygen species. So it's very, very interesting. What I'm talking about here is not just confined to medicine. We're actually seeing these concepts of what ozone does being used in very broad aspects around the world. So I thought that was pretty interesting. All right, so how does ozone make us healthy? Well, we've already really gone into the fact that lack of oxygen causes inflammation, a slow metabolism, and it impairs the mitochondria's ability to make energy. Ozone adds 3 oxygen atoms to your body, which equals more oxygen and more production of water. Now that's a very simplified way for me to explain it to you. If I decided to biochemically tell you how ozone does all this, you would leave. You wouldn't be here. You'd, say, yeah, I don't need that chemistry lesson. But essentially, 3 oxygen atoms makes more oxygen in your body, and it creates more water. So that addition of oxygen and water, it helps decrease inflammation, it enhances metabolism, and it produces energy. So it does all those things that we were talking about that we need your mitochondria to do more of. Okay, hopefully I spelled Tesla right. Okay, question. What does Nikola Tesla and our office have in common? Ozone. Medical ozone generators. So Tesla, behind the car, that genius, right? He actually was one of the first scientists to create a medical ozone machine. And he founded one of the first companies that was studying medical ozone. So Tesla, he had his fingers in a lot of different things, that's for sure. That man was doing a lot. And one of the things he was really into was ozone. So that was almost 100 years ago. So ozone in medicine has actually been around for many, many years. In, I believe it was 1912 or 1915, there was a German doctor who was using ozone in the fields in World War I to treat gangrene, and very successfully. So we have a lot of history of ozone being used, even though it hasn't really been used or introduced to mainstream medicine necessarily as a medical treatment until, fairly recently here in this country, although Europe has been using medical ozone for quite a long time. One of the really interesting things about using ozone as a gas, I guess I didn't say that. Ozone's a gas, just like oxygen is a gas. So that's one thing to remember when we get into the therapies themselves, is that ozone is a gas. So when we're introducing it to the body, there's obviously some things we need to be careful with, and then there's some really cool properties of using a gas versus using a liquid that we'll discuss. So a great question is ozone therapy safe? The short answer is yes, it's very safe. It has a long history of use in medicine. It's been used in dentistry for quite a while and in veterinary medicine. Those fancy racehorses, they get everything before we humans do, I'll tell you. They've been using ozone in those horses for quite a long time. And who was it? I had a patient. Tell me if you're here. Yes. Do you want to share that story?
So I have a friend who is actually in the rodeo circuit. She trains and does vet work for horses in Florida. And she's been doing ozone therapy with them for a very long time. And she has saved several foals and fillies and several horses that vets have given up on for ozone.
Yeah, I love it. So using it all over the place. And horses are really expensive, so they kind of do everything they can to keep them alive and well. All right. Back to, is ozone therapy safe? Obviously, everything goes back to the dose. If you're using a very high dose of ozone and you're using it in a way that is like breathing it in, that's not safe. So we actually do not want to be breathing ozone in. It is a respiratory toxin in high doses. There's certain machines that have a lot of ozone off-gassing, and some places actually have to have ozone monitors to make sure that the air quality is appropriate and not over a certain limit, because that can cause respiratory toxicity. Also, people with asthma, if they breathe in too much ozone, they definitely can have asthmatic situations. So, as we've discussed, ozone is a fairly powerful therapeutic agent, and it stimulates the mitochondria, it stimulates the immune system, it decreases inflammation, and it regenerates tissue. So all in all, if you are trained appropriately, which both Dr. Steelsmith and I have been certified in ozone therapy, if you are trained appropriately and know how to use it, it is a very safe and effective therapy. Okay. I'm going to talk about the therapeutic uses of ozone next. So here we've listed the most common ways that you can use medical ozone. The first is IV ozone. Then we have something called prolozone. We have scar therapy, saunas, limb bagging, topical, and oral. And I'm going to go through each of these in depth. And we will start with IV ozone. IV ozone is also known as MAH, stands for Major Auto Chemotherapy. What's happening is that we are not adding ozone as a gas directly to your vein. And IV stands for intravenous. Okay, so this is taking ozone and introducing it inside your body via the veins. We are adding ozone to blood that is actually removed from the body, like as if you were donating blood. And then the ozone is added into that donated blood. And then that blood is put back into the body. Now, it sounds kind of simple, but the effects are quite profound. So I'm going to go into some of what happens when we introduce the ozone to the blood and then put it back into the body. So the first thing is that when we remove blood from the body, most of it is red blood cells. And red blood cells carry your oxygen. 3 to 6% of all the cells are immune system cells, okay? White blood cells. So those are your immune system cells. They fight infections. They do all kinds of good things for your body. They fight cancer, all of that. When ozone hits the blood itself, it is instantly turned into something else. Ozone is so unstable that it exists for a very, very short time. Milliseconds, in fact. The second it hits something, it turns into something else. And that's why ozone is so different than oxygen itself, because oxygen is a very stable molecule. Not much happens when you pump oxygen just into your blood. Nothing really happens because oxygen's stable. It's not going to interact with anything, but ozone is 3 molecules of oxygen. That extra molecule of oxygen wants to go somewhere else, right? It's like a group of 3 people that are all good friends, but like one of them really wants to go over to that group. They're always going to go somewhere else. They're just gone in a second, okay? And when that ozone hits the white blood cells that are in the blood, it creates something called an ozonide, and these ozonides create a cytokine reaction, which is a reaction that happens in your immune system cells, which basically supercharges your immune system. So it takes this little immune system cell and it turns it into Superman. And it does that to about 3 to 6% of them. Then those Superman immune system cells go back into your body, and they go to your spleen, and they go to your lymph nodes, and they travel all around your body, and every other immune system cell they meet, it's like they transfer their superpowers. And all of a sudden, you have this immune system that is going to do great things, right? And that's why the ozone therapy is so amazing for infections. So when I'm talking about the chronic viral infections, the Lyme disease, the way that we're treating those people is with this IV ozone. Because what we want is we want those Superman immune system cells to travel everywhere, find that virus, and attack it, and create an amazing reaction. It's very different from an antibiotic, however. Antibiotics are cytotoxic, so they're going to kill the bacteria. Ozone is going to create this cytokine reaction. So it's actually going to create this immune system that is now stronger inside your own body to fight whatever's going on. So it's very, very cool. It works well in conjunction with antibiotics. You can use it in early stages instead of an antibiotic. Obviously, we would be deciding whether we would do that or not. Your doctor would. But very, very cool. All right. IV ozone is also used for our cancer patients. Because what happens in cancer, well, we have this issue where the cells become hypoxic, they wall themselves off, so we want to introduce a lot more oxygen to around those cancer cells, but we also want to supercharge your immune system. If we can improve your immune system to scavenge and fight against the cancer, then that's going to be a very good thing. So doing this IV ozone in anyone with cancer, history of cancer, is a really amazing thing. It can be used in conjunction with some of our other IV nutrients, especially something called vitamin C. And vitamin C is one of these other types of nutrients that we are using quite successfully in many cancer patients. And we find that adding just that little bit of oxygen to give an increase in oxidation and then antioxidation with the vitamin C is an amazing thing. Obviously, if you're coming down with a cold or a flu, something like this might be the key. Get it early enough, could knock it out. Had lots of different stories about that happening. And then, of course, pre and post surgery, which I was talking about earlier. this would be the type of therapy that we would think about. It's called preconditioning, where we pump you up with all this great oxygen and a really strong immune system. Then you have your surgery and your recovery is so much better. This IV ozone is also what we're using in any of the cardiovascular disease, so heart attack, stroke, anything. If someone has had a first event doing the IV ozone, some of the cardiologists were talking about how they've never seen a repeat cardiac event after starting IV ozone on their patients, which is staggering. Heart disease itself, coronary artery disease, that's an inflammatory condition. Adding oxygen into the system this way, it will go straight to that lining in your blood vessels in your heart and be very effective. Okay, prolozone. So this is what Dr. Steelsmith was alluding to. She received prolozone a few different times and really completely healed several different things going on. This is where we inject ozone into the joints or the soft tissue, such as your muscles or the fascia. What happens is ozone is a gas. So when it's injected in the gas state into a joint or into the soft tissue, it will travel anywhere. When I use liquid, like a Prolo solution, which are nutrients in a liquid form, I am relying on my needle to get to exactly where I need to be and putting the fluid there, and the fluid will stay where my needle went. When you add gas, the gas can travel everywhere. So if I've been, in the past treating a knee with maybe 5 different injections all over the knee, because we have to, get in the medial side, and then I got to get the lateral side, and then I got to get the meniscus, and then I got to get the patella, and I'm going all these different injections in the past, I can now use 1, maybe 2 injections and spread this ozone gas into the entire area, because ozone will travel rapidly. And as ozone goes into the joints and the soft tissue space, it also instantly disappears. It turns into something else, like oxygen, okay? It's great for pain, stiffness, injuries, any decreased range of motion, arthritis, disc injuries. In fact, there's a lot of research on herniated discs and using ozone therapy successfully for people who chose not to do surgery. So that's a great thing to know. Usually when we're doing ozone in our office, we're combining it often with some of our other pain treatments like trigger point therapy, something called NPT, which is using a medical grade sugar water, acupuncture, prolotherapy, PRP, which is platelet-rich plasma. I mean, the beautiful thing is that you can combine this with everything and anything that we're already doing. We don't just inject ozone alone. We actually, as we're doing the procedure, we are injecting some nutrients ahead of time, which helps your body utilize that oxygen a little more effectively. So we're using a nutritive numbing agent. We're using some B vitamins, like I talked about how B vitamins are so crucial in the mitochondria. So that's going in first, then the gas follows. Some other interesting uses of the prolozone, the injectable ozone, is for dental infections, chronic sinusitis, and TMJ disorders. I've already had multiple patients texting me about how they did after a TMJ joint injection. They were at the end of their rope. We tried everything, NPT, acupuncture, trigger point therapy, and I came back from the conference and I was like, okay, before you have to go do the Botox or whatever, let's just try the ozone. And literally patients are like, oh my God, I can't believe it. I can open my mouth, I have no pain, amazing stuff. So things like the TMJ, the chronic sinusitis, that can clear chronic sinusitis up like that. Like even before they've left my office, patients are like, I can breathe better than I've been able to breathe in years, right? And when you think about it, chronic sinusitis is often a fungal problem, that bugs that have been hanging out in there that really, they don't really go away. Maybe antibiotics don't kill them off completely, and they do rounds of antibiotics that help here and there, but the problem always comes back. That ozone is going to be highly anti-infectious, so it really makes a difference for people. It can also be used to treat migraines. So there is something called ozone scar therapy, and this can be used for any type of scar that we may have on the body. It could be used for scarring like I was talking about after hysterectomy. It could be used for a scar after a back surgery, a knee surgery. One of the things that happens when we get scars is that it changes the fascia system. So where there's a scar, you're going to get a slight pulling effect that's going to travel a long length of tissue. Even if you might not feel a scar being painful, often we find that people have other associated pain. Like maybe we have a scar from a mastectomy, and then patients are like, this right shoulder, it just doesn't ever feel right. I have pain in it. And often it can be from the pulling effect of what that scar is doing to the rest of the tissue. When we inject scars with ozone, essentially we are adding that oxygen that those tissues have lost because they've been scarring, and it's improving the pain, and it's improving and breaking up those adhesions so that the scar now actually moves easier. So I just did a low back, a really large low back scar last week. I saw the patient a few days ago, and already I could just pick the scar up and move it. It just, the tissue underneath just slid easily, whereas before I would pick it up and everything's stuck together. Now it's free flowing. The scar's still there. It's not going to make your scar more beautiful necessarily or anything like that, but it's going to change that adhesions that are happening within it. Again, we inject nutrients first, and then we inject the ozone with this therapy as well. Ozone saunas. So this is interesting. We right now do not have the capability in our office to do ozone saunas, but it's used for detoxification. And what's very cool is that it removes heavy metals. So that mercury toxicity we were talking about that kills your mitochondria, well, we could help you get rid of it. And we can use saunas that include ozone. Now, if you're familiar with regular saunas, like a dry sauna or a hot sauna that you walk in, it's not like that. It's actually a booth where your head sticks out of it, so you're not breathing that ozone in. You're just, the rest of your body is being bathed with ozone, but your head is free, because we really don't want you breathing all of the ozone. It enhances circulation. So we actually have a remarkable ability to absorb ozone transdermally across our skin membrane if we have moisture. So sauna heats things up, and then we have the ozone circulating in, and that ozone will just go through into all your system just through your skin. So this is a really cool therapy for children. We had some doctors at the conference talking about children with ADD and ADHD, because you might not want to be drawing a little kid's blood multiple times a week, every week for 16 treatments. That's maybe not the funnest thing to do. So how else could we get ozone and enhanced oxygen utilization? A sauna with ozone is a great option for the kids. It's also great for your skin. So people who have really bad skin infections, skin rashes, this is a great option as well. And you are getting the systemic treatment while relaxing in a warm sauna. So we'll take orders if anybody wants to front us an ozone sauna. We'll be happy to take an order. All right, a few other ozone uses, and we're really close to done. So, limb bagging. That's where you get a bag, literally a plastic bag, and you put it over a limb like a foot, and then you pump ozone gas into it, and then you seal it, and you allow the ozone to hang out over that limb for a certain amount of time. It's very useful for toenail fungus. It's very useful for non-healing wounds, ulcers, skin infections, skin rashes. So that's an interesting way of doing treatment. It can enhance circulation. So in maybe some of the diabetic patients where they have a really a real situation happening with ulcers on their feet and circulation issues in their feet, you could consider something like that. Then we have topical. Ozone can be added to olive oil, and that can then be applied topically as well to skin rashes, lesions. Some of the aesthetic people at the conference were talking about how it's great for fine wrinkles and it'll, help with your face and all that kind of thing. So there's some interesting things you can use topically. You can drop it in the ear canal for ear infections. It's a wonderful option for kids who have a lot of ear infections. And then we have oral. That's where we make capsules, maybe of that ozone-infused olive oil, and then you can swallow capsules that could help for digestive issues. SIBO, small intestine bacterial overgrowth, we're always looking for antimicrobial options for people like with that. Ulcerative colitis, where they have major inflammation happening in their lower intestines. All of these things we could consider using an oral ozone for. So this is Dr. Frank Schallenberger. He's basically the guru of ozone. He calls himself the godfather of ozone. He's amazing. He's 72, and he literally spoke for 5 days straight, 8 a.m. till 6 p.m., kind of a rock star. He does IV ozone on himself every week, and he swears that ozone is what keeps him going. And he likes to say that nothing good happens when you age, but ozone therapy can help change how you age. So thank you, Dr. Schallenberger. And I'm going to open up to some questions.
If one has nerve damage to a foot without having diabetes, what would you suggest?
So nerve damage to the foot. Obviously, we'd want to understand maybe why there's nerve damage in the foot, right?
Doctors don't know.
Doctors don't know, right? So have you seen a naturopath yet?
No.
Okay. So we are really good investigators, and obviously we would want to find out from our point of view what might be causing that, and then from there decide what type of treatment, because there's a lot of different things that nerve damage can come from. So we'd want to look at that, and then based on that we may consider some of the injectable treatments that we know help to rehabilitate nerves, maybe ozone, but I'm not quite sure because I'd really want to take the case and understand what's happening. Yeah. Yes.
10 years ago, I was looking for oxygen therapy for a systemic candida infection and found one here locally, but they used hydrogen peroxide IV, and I didn't like it. I think it affected breathing. And what is the difference between this and that?
Yeah. So her question is about hydrogen peroxide IVs versus something like ozone IVs. Hydrogen peroxide honestly works quite a bit differently. It's not going to be the same in terms of ozone, which is very unstable, and that extra ozone molecule is going to do so much more than the hydrogen peroxide is going to do. Also, hydrogen peroxide is very damaging to veins.
Yeah. And it hurts.
It hurts a lot,
It
and so
hurts.
it's really has fallen out of favor, honestly. I don't ever use IV hydrogen peroxide because I don't have the need to. IV vitamin C actually has an ability to turn into hydrogen peroxide at the level of the cell membrane. So you're going to get a better hydrogen peroxide effect using IV vitamin C, and then ozone itself is going to be leaps and bounds better than the hydrogen peroxide. Yeah.
Actually, related to that question, what is the difference between hyperbaric oxygen chamber and the ozone?
It's a great question. So wondering about the difference between hyperbaric oxygen chamber versus ozone therapy. Again, hyperbaric oxygen is actually just increasing the pressure of oxygen so that you're getting more oxygen via what you're breathing in. So it is a great therapy, and there are a lot of really amazing things that hyperbaric oxygen will do, and it does increase oxygen in a certain way in the body, but what you will not necessarily get is you will not get the activation of your cytokine system, and you will not get the same activation of the mitochondria from hyperbaric oxygen as you will from that ozone.
Can ozone therapy be used to treat like leaky gut syndrome?
Good question. So wondering if ozone can help with leaky gut syndrome. So leaky gut syndrome, obviously we want to kind of look into why someone has the leaky gut syndrome, you know, what's going on there. And we want to work on fixing all those other pieces because at our heart we are naturopaths and we want to find the cause, treat the cause. But if the leaky gut is due to infection, like a small intestine bacterial overgrowth, which can be a very common cause, it absolutely could be affected, probably in that oral form. Yes, did you have a question?
Hi, yes. Can the blood that's drawn from the body be kept at a very low temperature and reused? You know,
Say it again, can it be kept at a low temperature?
And be reused.
take blood out, can it be frozen or something and reused?
Oh, okay. So during the IV ozone, the appropriate way that we've been trained is to remove it, add the ozone, and then put it back in immediately after. I would not be keeping it or freezing it or anything like that. And I should mention that in case someone is wondering in the audience, we do have a very specific way to draw the blood and prevent clotting from occurring, because anytime you remove blood from the body, if you are not careful, you will get clotting, and if you put a clot back in, that's not a very good thing. So it's actually done very specifically with some heparin, which is a molecule that helps prevent clotting, to make sure there's no clotting, so it's very safe when you're adding the blood back in. And it's very quick. You're drawing it out, adding ozone, and it's going right back in a matter of, 20 minutes. Yes?
How much blood is drawn?
So how much blood is drawn, it depends. Obviously, when we see the patient, we make our prescription according to what the diagnosis is, what the symptoms are, the vitality of the patient itself. So it can be anywhere from 50 milliliters all the way up to 250 milliliters of blood. Average is about 100 milliliters of blood. So if you think about a bag, like a donation blood bag, it's most of the time average is going to fill it up like about that much. Yes?
So, what is estimated duration and maintenance of blood? So, for example, with autoimmune disease and leaky gut, would it be every day for a week, once a month, and then what does the maintenance look like?
Okay, so she's wondering about the details of how often do we need to do this therapy. And I will tell you it's like exercise. How often should you exercise? Often, in order to get a result. So when we start with the IV ozone, especially for autoimmune, we are going to start at least 2 days a week. That's ideal. And we're going to do it for at least 10 to 16 treatments. So the sweet spot is between 10 to 16 treatments. And honestly, what we're looking at, we are often watching blood markers. So we're looking at those autoimmune markers. Have those antibody levels dropped? And that's a large way that I'm going to be gauging how many more and how often is I want to see black and white that this is working and we're having a reduction in that antibody status of the autoimmune. So 10 to 16 treatments, average twice a week, and then from there, maintenance might be once a month. It depends on how much improvement we've gotten. And that's an autoimmune. For patients with cancer, it might go longer. If patients are doing chemotherapy, we want to do it as close to the day of chemotherapy as we can. So it depends person to person and case to case, but that's a good average example. The Dr. Schallenberger that we trained under, he has a clinic outside of Reno, and he has patients who travel across the whole world to come see him. And they will stay for 3 weeks, and they will do an IV ozone in the morning and an IV ozone in the afternoon. And they will do that for 5 days a week for 3 weeks. So he basically supercharges them really rapidly and regularly, and then they go back to Australia or wherever it is they're visiting from. So there's a lot of different ways that you can do it. If something's a very acute, severe infection, we're going to be doing it more regularly.
What's the price range, approximate cost per treatment?
So all those different treatments have different price ranges. For IV ozone, I think the single treatment is $165, but we give a discount of, for a 4 package, because honestly most people aren't going to do a single one. Most people are going to need a few, so we offer a 4 package of 4 for reduced to $150 per IV. Prolozone, the cost varies a little bit, but on average, a joint full treatment is about $225.
For migraine headaches, is that at onset or is that prevented?
So it depends. We'd obviously want to look into what type of migraines the patient's having and what their cyclical nature is, but it could be something that we actually do maintenance-wise, preventatively, not just when you're having the migraine, because if we're thinking about migraines due to decreased oxygen utilization, it would be better if we can increase it in the system over time, and that will often decrease the migraines.
Do you inject it, like I get migraines, do you inject in the skull or more in the neck?
So often the injections for migraine are going to be in the neck. Yeah, not usually in the skull, mostly along the neck, anterior, posterior, where those muscles are involved.
Can ozone cure cancer?
Well, the question is, can ozone cure cancer? I never say that anything can cure cancer. I believe that it can be a very useful addition to anyone and everyone who is experiencing any type of cancer because of what it's going to do at that cellular level. It may make other therapies work even better. It's not necessarily a standalone treatment. It's usually done in conjunction with if the patient's doing chemo or radiation, or maybe they're doing IV vitamin C or an entire protocol. It's going to be something we add in. Yes.
Do you have a make or sell topical?
Yes, we have the ability to have that ozonated olive oil. I think we have a few bottles in the office.
How much?
I have no idea. Sorry. Oh, sorry, did you have a question?
How would you treat macular degeneration?
Right, so the question's macular degeneration. That is with IV ozone. So that's getting the systemic effect of ozone, and there's no we're not injecting the eye or anything like that. It's via IV. Yeah.
Would ozone help with someone who had a degenerative disc, so they basically no disc is bone on bone? They have a lot of pain right there. Would it help with that?
So the question is, would ozone help with a degenerated disc, which is bone on bone? The research shows that it will help the pain. Now, will it regenerate anything? That's another question entirely, but there's very good research showing people who have chosen ozone therapy, like prolozone, instead of surgery, and having great results.
Related to that macular degeneration question, does it slow it? What does it
Yeah,
do for it?
so it can slow it, but it can also improve the visual field mapping. So you can actually get improvements in the macular degeneration itself.
Can it help other eye diseases or just that one?
Well, he didn't mention anything about glaucoma, so I do not have anything I can say about that. I can say that the macular degeneration is kind of the slam dunk out of those eye disorders. It's really like, we don't have a lot to offer for macular degeneration, and this is pretty significant. Yeah.
How long does it stay in your system? Like you said, it travels. I was thinking, well, how long does it stay?
Okay, so how long does it stay? Well, if we're talking about IV ozone, it's instantly gone, but the effects last.
In other words, is it something you have to keep doing for the rest of your life?
Oh,
or-
okay, great. So, Dr. Schallenberger would say yes, because we're always aging, and we want to prevent our mitochondria from dying, and this is an excellent way to do that. So, potentially you could do it for the rest of your life if one wanted to, or potentially you could do it for a certain number of times for a specific disease situation that we're trying to address. So that's kind of a question that I would say individually talking with your doctor to determine what might be best for you would be a good solution.
But can it totally eradicate Lyme's?
It has been shown to be very effective in putting people into remission with Lyme disease, yes. Yes?
Can it help improve bone density and osteoporosis?
Can it help improve bone density and osteoporosis? I don't know that it will improve bone density, but osteoporosis is a disease and disorder of aging, and it will help with aging and improving oxygen utilization. But do I have any research on anything regarding osteoporosis and ozone? I don't. So I cannot, and I don't have any patient cases either. So that would be probably a question that if we were in the treatment room discussing, I would want to reach out to Dr. Schallenberger and pick his brain on it, because honestly I don't really know.
Can ozone be used for dementia or Alzheimer's? Are there any studies?
Yeah, ozone can be used in those neurodegenerative diseases. Again, I wouldn't use it as probably a standalone, because Alzheimer's is a very complicated disease, but the brain needs oxygen. And dementia, Parkinson's, Alzheimer's, they are situations where the brain is deeply deprived of a normal functioning cellular system. So it does absolutely make a difference in adding into a treatment plan. Yeah. Okay, so we are right at 7:30, and I just want to say a big thank you to everybody for coming, and if you have more questions, please contact us. And